Okay, good morning, everybody. I think we'll go ahead and get started. My name is Becky Fetters with Telligent, and I have Leslie Madison here with me as well. I would like to thank you for taking time to attend today's webinar. If you have not already done so, please make sure your microphones are on mute. You can also press *6 to mute your line. There will be an opportunity for questions at the end of this presentation. The Society of Thoracic Surgeons has selected Telligent to perform an independent external audit of the STS General Thoracic Surgery database. Telligent has been privileged to conduct audits on behalf of STS since 2006. As a QIN/QIO, Quality Improvement Network, Quality Improvement Organization, Telligent is HIPAA compliant, and audits are performed while adhering to strict security policies in accordance with our contract with STS. Today we will be discussing the instructions and attachments for the audit that you received from Telligent. We'll go ahead and get started with attachment 1. This document provides an overview of the audit process and also discusses the other attachments. The audit will involve data reabstraction on 20 randomly sampled lobectomy and esophagectomy cases that were performed between January 1st, 2015 and December 31st, 2015. An OR log comparison will be done to compare cases performed with cases submitted to DCRI, and the data collection questionnaire from sites will be reviewed. A summary conference with each site will take place following completion of the audit. Telligent will need to receive the medical records for the 20 cases via our secure file transfer web portal within 4 weeks of the final webinar on August 11th. This date will be September 8th. Any audit-related questions should be sent to ststhoracic@telligent.com. Please be sure to include your participant ID in the subject line of any emails that you send. Attachment 2 is our secure file transfer instructions. An email should be sent to ststhoracic@telligent.com within 1 week after this webinar with the contact information for the person that will be transmitting the medical records and other information needed for the audit. A secure file transfer web portal account will be created, and that individual will receive emails with their account information and temporary password. We ask that each site designate one individual as responsible for uploading the files, such as the data manager or an individual in health information management. The data manager should be familiar with the information that is uploaded in case there are questions on where something is located in the medical record or if there is missing information. Files can be sent as a PDF or zip file. They are uploaded directly to a secure folder for each site. There is a 1 gigabyte file size limit per upload. Each file should include only one patient. Please do not send multiple patients in one file. It is helpful to include the patient ID or medical record number in the name of the file. If multiple files are sent for one patient due to the size limit, they can be labeled with number 1, number 2, hospital records, mortality status, etc. Once your account is active, we suggest uploading attachments 3, 4, and 5 to become familiar with the process before you upload medical records. It may be helpful to discuss with your IT or medical records department the process of transferring medical records to the secure file transfer web portal. And I just want to run through this attachment real quick about the process. So once you get your account, we'll send you emails with your username and a temporary password. You'll log into this HTTPS address, and you'll enter your password, your temporary password, your username, and temporary password. It'll prompt you to change, and then that will be your new login. So this is our login screen, and once you log in, it will take you to a secure folders page, and it'll look a little bit more like this down here. And there'll be an upload button right here in this little area. You click that upload button, and it'll bring up a Browse dialog box. You find your file that you want to upload, and go ahead and select it, and then click Open. And that downloads the file, and then you will see the list of the files that you've downloaded. It's very easy. It's also secure. We use this a lot for getting records. And then once you upload something, it will send you a confirmation email. If you have questions or you're having problems while trying to upload records, please send an email to ststhoracic@telegen.com, and we'll be available to help with any issues or concerns you're having. Attachment 3, this is the list you received with the 20 cases that were selected for audit. It came to you with the first few boxes filled out with the procedure, the surgery date, the record ID. You will need to complete the last 3 columns on the list that are here in yellow and return it via the secure file transfer web portal. This will include a patient identifier or medical record number, the 30-day mortality status, and 30-day readmission information. Please remember to provide documentation with your uploaded records to support your answer for 30-day mortality status. You do not need to send the records with the case list. You'll send them at the time that you upload the other medical records. Documentation can include an office visit note, lab worker testing, a progress note of a phone call, an emergency room visit, anything that's evidence of a live or dead status after 30 days. The data elements list on pages 2 and 3 of attachment 1 includes the data elements that will be re-abstracted. And you can see there's 43 of them here. This lists them all out. Be sure to include all documentation that applies to each element. Include all document sources that you use to abstract each data variable. For example, we need all the testing reports, all the physician progress notes and orders, all the H&Ps and consults. Send all the data sources that you use to abstract your information to the database, not just the page that the information was found on. It's very important to include preoperative testing information such as PFTs, CAT scans, PET scans, and endobronchial and endoscopic ultrasound reports. Include information on preoperative chemotherapy or radiation therapy. Pre-op information is what is usually omitted the most, and if it is not uploaded, the auditors will have to contact you for additional information. Be sure to send operative reports, pathology reports, as well as information for clinical staging. Include documentation pertinent to any postoperative events such as pneumonia or prolonged ventilation, and this might include respiratory therapy notes. It is not necessary to send nursing care plans, PT and OT records, living wills, or consent forms. Include any records on readmission within 30 days, as well as your documentation to support your status at 30 days. And again, the medical records for the 20 selected cases will need to be received within 4 weeks of this webinar, which will be September 8th. All sites are given the same amount of time to submit the records, and this just ensures that we receive the information in a timely manner so that we may focus on completing the audits. If additional information is requested to complete the audit, you will be contacted by an auditor and given 5 business days to submit the information. If the additional information is not received within 5 days, it will be counted as a mismatch for auditing purposes. Additional information must be sent to Telegen's Secure File Transfer web portal, and please send an email to ststhoracic@telegen.com when additional information is uploaded, and be sure to include your participant ID. Attachment 4 is the data collection questionnaire, and I've already received quite a few of these back from the site, so thank you. You guys are doing a good job of getting those filled out. The answers are very complete and concise. This questionnaire provides information on your data abstraction and submission process. Please complete the questionnaire in detail and do not leave any blanks. The document is formatted to allow you as much space as you need to enter the information. This form is sent directly to STS for review upon completion of the audit. Return this questionnaire via the secure file transfer web portal or email to ststhoracic@telegen.com. Attachment 5 is our STS participant contact information. This is the contact information that was provided to Telegen by STS. This information is used for communication between the sites and STS, and Telegen also uses this for information such as the primary data contact phone number and email. Please review and update the information if needed. Make any changes in red. Please return the form even if no changes have been made to confirm it is correct. This form will be sent to STS upon completion of the audit. Return this form via secure file transfer web portal or email to ststhoracic@telegen.com. Part of the audit is the OR log comparison review. The auditors perform a comparison of surgical cases that were performed during the audit time frame to cases that were submitted to BCRI. Please provide a copy of the OR log or spreadsheet that contains a list of lung and esophageal cases performed from January 1st, 2015 to December 31st, 2015. This list should also include the dates of those cases and the procedure description for each case. Do not include procedures other than lung and esophageal cases. Because this has PHI, please return the OR log via secure file transfer web portal. The audit preparation checklist, this is just to help you with the requirements of the audit. It includes a summary of each step involved in the process. So it just runs through each attachment that needs to be returned and where to return it to. Once the audit has been completed, you will receive an email to schedule a summary call to review the results. Anyone is welcome to participate on the call. The surgeon representative is invited to attend, but it's not required. The data summary reports, the data collection questionnaire, and the updated contact information will be sent to STS. STS will review the reports and send them to the primary data contact and the surgeon representative. If you have not received these reports within 30 days after the summary call, send an email to ststhoracic@telegen.com. Again, I'd like to thank everyone for taking time to attend today. We look forward to working with you as we complete the audit. This webinar will also be recorded and will be available on the STS website to anyone who would like to view it at a later date. If you would like access to the recorded version, please send an email to ststhoracic@telegen.com and we'll provide you with a link to the recording. I'm going to go ahead and open up the floor for any questions that you guys might have. If you use *6 to mute your phone, press #6 to unmute.
The leader has unmuted your line.
Are there any questions?
So you had mentioned initially that all these files should be uploaded through the portal in a PDF or zip file format, correct?
Yes, that's usually the best way to send large amounts of information that we'll be getting.
Okay, so any other documentation that would support whatever has been submitted would have to then be scanned into a PDF and then combined into a zip file to be uploaded as a patient record. So the documents we're discussing are not just the documents during the patient's stay. They could be supporting documents pre-op or before the stay and even after the stay, correct?
Correct.
Okay.
And you don't have to send those all in one file. You can send a file for each patient with the hospital records and then one for the mortality status, one for pre-op testing. That's okay if you have to do it in more than one file. Just make sure there's only one patient in file so the records aren't combine multiple patients in one file.
You just have to identify what portion of the file it is when you get it for that one particular patient. Okay.
Yes. It's
And
nice
as
to
far
put
as
in
the
date.
OR record or spreadsheet, do you want in that spreadsheet, do you want all lobectomies or esophagectomies performed during that 2015 period, or just the 20 that we are looking for?
No, we need all of the cases that were performed.
Okay, so you're actually looking for a list of those records for 2015, inclusive of the 20 you will be auditing.
We don't need the records. We just need, an OR log or a spreadsheet with the cases and the dates they were.
Correct. When I say records, I indicate, the information for that one patient stay or one lobectomy, and for that time period. I'm not talking about the actual medical record.
Oh, okay, absolutely.
I'm sorry, I'm a data manager. That's how I talk. I'm sorry.
No,
All right, very good. That's all the questions I have.
Okay. Anyone else have any questions?
I have a question. We had just gotten through with the adult cardiac audit, and the number 3, the attachment where you're doing the 30-day mortality. When I sent that folder in, when I sent my documentation of that they were alive. So now you're saying don't send it with that, send it with the record?
Well, we need some form of medical records. You fill out on the case list alive or dead status, and then you need to submit something to support that with the medical record.
I did that as a file with that. So can we do it that way, or do we have to send it with the record?
I'll have to check. You said you were Rhonda Eaton, is that correct? Let me check and see. You sent that as an email, or you already uploaded that to the...
We had already uploaded that on the adult cardiac, and on that they said that was fine, and we didn't have to send it again when we sent the record.
Okay. Let me check. I'll get an email out to you. I'll contact you.
Okay.
It's Kelly from Meridian. I have 2 questions. The first one, with the OR logs, I did pull mine. I have 4 different sites I'm looking at, and frequently the description for the procedure is put in the preoperative time frame by the nurse, and sometimes the procedure changes. So I found some that were put in as lobectomies that didn't end up being a lobectomy, and some that were maybe put in as a wedge and ended up being a lobectomy. So I'm a little confused on how to send the OR log because it's not really going to be accurate.
Oh, so I think if we find a case that we think may have gotten missed in being submitted, we'll probably contact you, and then you can just verify that maybe that case wasn't how it showed up on the OR log.
Okay. So am I better off just sending you the whole log, or just still send you the ones that have the description of the lobectomy or esophagectomy?
You can certainly send a spreadsheet with just the ones just the cases that were the lobectomy, and yeah, that would be fine.
Okay. And my other question, again, it's the 30-day status, which I hear most questions are. The other thing we were told by the STS is we could keep a log that if a patient didn't physically visit any sites or the doctor's office, that a phone contact would be sufficient to say that we spoke to them on the phone, that they're doing well, they didn't have any complications, didn't visit another hospital. How do we send that supporting documentation if it's just a phone call?
You said you have it in like a spreadsheet or on a log sheet?
No, I just kind of handwrite it on my data collection form.
Okay. Well, if you can, just send that as a file somehow to the secure file transfer web portal, just label it that it's mortality status, that would be fine, and we'll just look up each patient on that.
Okay. Yeah, there's only a couple of them, but I just wanted to bring that up. Okay. All right. Thank you. I'm done.
Okay. Okay. Anyone else have any questions?
Yes, this is Stacey. I am doing this out of the surgeon's office, so my medical record number is different from the hospital's medical record number. Do you want me to put both of those on there?
You could. That way, when we pull up a record, we'll be able to link it somehow with the patient on the 20 case list. Yeah.
Okay. Thank you.
Mm-hmm. If anyone else does think of any questions after this webinar, please just send us an email, and we'll get in contact with you and go over anything. Any other questions from anybody out there? Okay. Well, it's been great talking with you guys, and we look forward to doing this audit. So, like I said, if anyone has a question, just send us an email, and I'll probably be getting some with the information later in the day, I'd imagine. And thank you all.